बिस्मिल्लाहिर्रहमानिर्रहीम नहमदुहु व नुसल्ली अला रसूलिहिल करीम सुब्हान रब्बिका रब्बिल इज्जति अम्मा यसिफून व सलामुन अलल मुरसलीन वल्हम्दुलिल्लाहि रब्बिल आलमीन. Hope all of my students are in good shape and they are preparing well. As you know, the exam is not very far off. So at the same time, you have to take good care of your health and also of your loved ones around you. We come to one important topic of pharmacology. Not only here in pharmacology, you will also study in toxicology, there in forensic medicine. It's a worldwide problem, and you are all familiar with the word alcohol. In general, when we say alcohol, it is ethyl alcohol. You must have gone through the structure of ethyl alcohol. So the other alcohols are also there, so like methyl alcohol or methanol. Ethyl alcohol is also known as ethanol, and another alcohol is ethylene glycol. So as concerned the history of alcohols, it dates back to say around 8,000 years, and according to the Islamic history, 1400 years back in the Holy Quran. So it was forbidden, and the Sahaba Karam, they had broken the pictures. So it's not allowed in our religion. And well-known word for the alcohols, it is known as Ummul Khabais in Arabic. Ummul Khabais. Means mother, ma. Khabais, all the mean bad things are there in it. So in the Holy Quran it is written that it has some of the advantages, but mostly it is hazardous. So it has got damaging effect, not only on the body, a human body, but also on the surrounding and also on the economy. Well, after that, about the incidence. So around 10% of the Americans, they note the word abuse. And 75% of the population, adult population, they use in routine as for sedation or for recreation like that. So at the same time, another figure is there. 50% of the accidents, fatal accidents, they are related to the alcohol ingestion. 50%. And another stat about the alcohols, that 30% of the people which consume it, there is chronic ingestion of the alcohol. They suffer from comorbidities. So others, diseases, they occur in the body. So it is known as, again, I would like to say, Ummul Khabais. Coming to the number of slides are over here, and these are to be completed in 45 minutes because of the time limits, as your exam is not far off. So we will go through those and we will touch. Ethyl alcohol is a small molecule. It is absorbed from all body surfaces. So it has got effects on almost all body systems. And mostly the effects are hazardous. So we go through the slides and discuss it. Here you see, the ethanol or the ethyl alcohol, it is grouped in pharmacology. The pharmacology group is in the sedative hypnotics. Sedative hypnotics for sedation or for sleep they are used, and they have got amnesic effect, sedation. One feels calm if taken in proper environment and proper dose. So, another uh, topic under which this ethanol is would be discussed, that is the drugs abuse. Note down the drugs abused. So, ethanol is the most important alcohol of pharmacologic interest. It has certain names are given to it according to the concentration of ethyl alcohol, like the beer, wine, etc., brandy, and so many uh, preparations are there in different countries. So the normal nowadays, as you go through the sanitizer, hand sanitizer, they contain around 60 to 70% of it. And there is also in that in those sanitizer, glycerine is there, uh, hydrogen peroxide is there. So you should also have this general knowledge of what lies in the hand sanitizer. Alcohol is the most commonly abused drug. Most commonly, you have been told that 10% people you have used it. Uh, in America, the adults. So it is the more commonly abused drug in the world, causes major medical and socio-economic. You see, I mean, even the poor people, they try to take it uh, low quality, and you see if you go through the newspapers, you see, I mean, there are deaths, and mostly these are due to, I mean, this and not properly prepared and the toxicity effects of the alcohol preparation made locally. Then coming to the next slide. In the United States, again we are repeating it, 70%, 5% of the adult population, they take it for pleasure effect. So there is no health risk. If written over here, there is no health risk, but the health risks are there. About 8% of the general population has an alcohol use disorder. A figure is given 8%. I mean, with the while taking alcohol for a longer period, so alcohol use disorders are there and in 8%. So the next one. So I've been told already that there are small water soluble molecules, very small size, say around 7 molecular, 7, 8 molecular weight, and absorbed from all body surfaces, inside, GIT, or even applied to the sponges are there to cool down body if the temperature is high. So rapidly absorbed and distributed. Absorption is distributed. It goes into all parts of the body. Volume of distribution is around 0.5 to 0.7 liter per kg. Volume of distribution. It crosses the biological membrane. You were told that it crosses all the membranes. And why the women are at a higher peak concentration than men. Reason being, right, note down over here, women have a high. The women, they have less enzyme in the say stomach and the GIT to metabolize it, so they have higher peak concentration and they are more affected by it. Then lower total body water content. Why the women are at higher peak concentration? They have higher peak concentration than men. They have lower total body water content. There is difference in the first pass metabolism. They have less, I mean, it is written that they have less metabolizing enzymes As their metabolism is something very important about the ethyl alcohol. There are two types of metabolism. You will see it later on in these slides. So another thing why the women have a higher peak concentration, they have decreased gastric metabolism. Decreased gastric metabolism by alcohol dehydrogenase. Note over here, this ADH is for alcohol dehydrogenase, not the antidote, not the again noted on. It is the alcohol dehydrogenase and it is converted to acetaldehyde. A well-known toxic effect acetaldehyde. Number of that has got so many toxic effects acetaldehyde. And the enzyme which is related for the conversion, there are two types of pathways. So you will see later on. Next, kinetic. So the main area where it is oxidized, it is oxidized in the liver 90%. While the excreted, if you come close to some person who is ingesting this alcohol, so it will appear in his breath. So breath test is one very important to know the level of this alcohol in consumption. So among the drivers like that, drunk driving, you might have heard this word, drunk driving. So excreted through lungs and kidneys. So here you see 7 to 10 gram of alcohol, it is metabolized per hour. It's special type, you are familiar with the special type of metabolism is there. So 7 to 10 gram of alcohol in 1 hour that is metabolized. Zero order kinetic, known as zero order kinetic. So here you say how there are two pathways. You see there are two enzyme system metabolize ethanol to acetaldehyde on right side, and you see the by MEOS, and on left side alcohol dehydrogenase NAD, NADH, and NADPH plus oxygen. These are the coenzymes. So ethanol is converted to acetaldehyde. Here you see the picture at the first step. This you have been told about acetaldehyde is something very toxic on various organs like the eye, like the heart, so on the brain. So it can be inhibited by fumepizole. Fumepizole, very important. So it means the ethanol will not convert into acetaldehyde, so the toxic effects may be avoided. Then acetaldehyde is further converted to acetate by aldehyde dehydrogenase. Aldehyde dehydrogenase. So there is one well-known drug, disulfiram. Note down disulfiram, also known as antabuse. So if taken before alcohol ingestion, so the acetaldehyde will not convert to acetate and further to carbon dioxide and water. So a person may stop taking this alcohol. How to avoid alcohol ingestion to get it treated. Disulfiram. These are two steps. Next, it is enlarged. Again, it is the same. Two enzyme systems metabolize ethanol to acetaldehyde, which is then oxidized to acetate. Next one, alcohol dehydrogenase pathway. It is the main pathway. Alcohol dehydrogenase, hydrogen is taken out. So metabolizes low to moderate doses of ethanol. Metabolizes low to moderate doses of ethanol. This ADH histolic NAD dependent enzyme. So found in liver, gut and brain. Liver, gut and brain. location of this alcohol-dehyde ADH. Genetic variation ADH enzymes affect the rate of ethanol metabolism. Genetic variations are there. Well, I have gone through the literature that it may go into genetics. Consumption may go over there. So genetic makeup is also affected. Then microsomal MeOs, ethanol oxidase. This is the second pathway. When the concentration of ethanol is more than 100 milligrams per deciliter, the liver microsomal mixed function oxidase system contributes significantly to ethanol metabolism. It has written over here, later. When the level of this ethanol is more than 100 milligram, as the level will go on, the more toxic effects will appear. So then the use is NADPH as a NADPH is a cofactor in this metabolism. The chronic ethanol consumption induces cytochrome P4. This is one very common question. The chronic use of ethanol. So what will happen? So it comes under the inducers, ethanol inducers, and MES activity. Induces cytochrome P4 enzyme synthesis, and MEOS activity is also enhanced. Next one. Acetaldehyde metabolism. You see, after the conversion of alcohol to acetaldehyde is further. Acetaldehyde dehydrogenase is there. Acetaldehyde formed from the oxidation of ethanol is rapidly metabolized to acetate by aldehyde dehydrogenase, a mitochondrial enzyme found in the liver and many other tissues. This acetaldehyde is also in the liver and also in the acetate. So the acetaldehyde it converts is converted to the acetate and further to the carbon dioxide and water, and also used to form acetyl coenzyme A. Some individuals, primarily of Asian descent, Asian races, they have genetic deficiency of aldehyde dehydrogenase. It means if there is deficiency of aldehyde, so acetaldehyde will accumulate. After consumption of even small quantities of ethanol, these individuals experience the toxic effects of acetaldehyde. So there will be nausea, vomiting, flushing due to accumulation. Not only here, the nausea, flushing reaction. Also, there are so many other adverse effects, say on the heart. There may be dysrhythmias, and so many other adverse effects. They appear even on the eye. They will appear. Toxic effects will appear on the eye. We will study it later on in this. Next, mechanism of action. Ethanol modulates how the ethanol it acts. Number of reactions are, they are related to the pharmacological effects of ethanol. Here is given ethanol modulates the function of a number of signaling proteins. Signaling proteins. This word is very important. Signaling mechanism, how the drugs act. You have also studied in the basic lectures, initial lecture. So it facilitates the GABA, action of GABA at GABA A receptors, so known as GABAergic. You have to concentrate on GABA concentrated on GABA. So it has got depressant effect, soothing effects, suppressant effect. So at the GABA, a very known picture is there where the GABA receptors are shown. So the GABAergic effect is there. That is. On other side, another neurotransmitter sort of inhibits the ability of glutamate to activate NMDA. This glutamate is an excitatory. The GABA is inhibitory, no doubt. Glutamate inhibits the ability of glutamate to activate NMDA receptors. So on one side there is suppression, on the other side the stimulant effect, the excitatory effect of the glutamate, that is suppressed. Next one, among the mechanism of action, number of enzymes, they are modified. Not written over here, they are whether activated or they are inhibited. Modification of the certain enzyme like adenyl cyclase, phospholipase, sodium potassium ATPase not written in this slide. Also calcium ATPase. So their effects are modified. Modified adenyl cyclase, phospholipase C, ion channels, and after that, effects of acute ethanol. Whenever you come across the toxicity, you have to see, what is the acute toxicity, what is the subacute, what is the chronic toxicity like that. So ethanol consumption, if it is taken acute. These are different steps. As the level of this increases, so the effects will also potentiate. First one, sedation is there, saying the sound wave. Then speech is affected. There is slurring. Judgment is affected. So the driver has to be very careful. Impaired judgment. If the level goes high, the judgment is not there. You have been told that accidents, 50% accidents, fatalities, they are related to excessive alcohol consumption. Then ataxia. Here you see the picture of ataxia. And another thing, disinhibited behavior. You might have heard, under the drunk state, so the, crimes are committed. Well known, I had gone through some paper that were about the well known that news. You might have heard about the murder of a lady. That the person who killed her, he was alcoholic, but not schizophrenic. I was going through it. So then there's CNS depression, disinhibited behavior, and there are blackouts. Periods, memory loss may be there. There are periods of memory loss. This is acute. And it's something very important you are going through. Very beautiful picture is taken by your Dr. Pracha, well known, your professor, assistant professor. That fellow is measuring the breath level of alcohol. Different blood alcohol concentration in milligram per deciliter. If it is 50 to 100, sedation is there, one feels better, subjective high, and the reaction time that goes down, slow reaction time. If the concentration further goes up, say from 100 to 200, their impaired motor function, slurred speech is slurring speech, ataxia there, from 200 to 300, there is emesis, vomiting is there, and stupor, insensibility is there. If further it increases 300 to 400, so may go into a state of coma, and after that there is death is due to respiratory depression. Respiratory depression. Right. This is a very important slide. You should know about it. As we come to the heart, this heart alcohol has got direct toxic effect on the myocardium. It depresses myocardial contractility. At a level that goes high, there may be arrhythmia, something very, very important. It has also injuring effect on the myocardium, injury to the. As concerns the smooth muscles, there is vasodilation. I mean, these sponges are used, alcohol sponges are used to bring down the temperature. Vasodilation. I mean, hypothermia. If person is taking it, there will be vasodilation and his temperature will go down. Among the smooth muscles, as concerns the uterus, previously in past history, this was given to suppress premature labor. Premature labor. So this is the word used for this premature labor. You must note down, please. Have a pen and a copy with you to note those words not given here in the slides, but you may be asked about it. So these drugs are known as tocolytics. Tocolytics. Lysis. Tocolytics. Uterus that relaxes. I mean to avoid premature labor. Then chronic well-known effect is on the liver, and the term is known as alcoholic fatty liver. And then there may be hepatitis. Then further may be cirrhosis further, and then liver failure. These are the steps, very important. Alcoholic fatty liver, important, very important term. Then women are more susceptible to alcohol hepatotoxicity. We have not developed. They have there are certain reasons are there why the women are more affected by alcohol hepatotoxicity. Here you see the chances of hepatitis B and C infection increases. Why the hepatitis B and C that increases is the risk of severe liver disease. If the side-by-side hepatitis B and C is there, so the risk of severe liver disease that will enhance. Mind it, please. This alcohol, ethyl alcohol, is also known as immunosuppressant. Immunosuppressant. So, number of diseases they will affect the person, like tuberculosis, viral disorders, because as the immunity nowadays you are all familiar. This corona is related to immunity. I mean, the people living in especially closed circuits and air-conditioned environment, they are more affected by corona as compared to the people working outside in fields and open air. So please, and the more comforts they are further suppressing our immunity. Next, GITs. You mean the injection is there. So what will happen? There may be gastritis, chronic, and pancreatitis. You've been told about pancreatitis. If the triglyceride level that goes high, there are more chances of pancreatitis. Yeah, but this alcohol, it also related to pancreatic gastritis. Intestine is injured, and I mean, there may be like that, diarrhea may be there, there may be anemias are there. So small intestine is injured, and malabsorption will occur of water-soluble vitamins. Vitamins are not properly absorbed, malabsorption. And blood loss. This microscopic blood loss may result in microscopic anemia, and also it's also written that macrocytic micro, that is why anemia. Also, there will be, if the GIT function is not proper, so there will be protein loss and protein malnutrition. On the CNS, you see, the CNS affected. Tolerance, what's tolerance? All of you should know. What are the reasons of tolerance? You should know. It's a common question, why question. Tolerance and dependence. Tolerance occurs mainly due to CNS adaptation and to a lesser extent by an increased rate of ethanol metabolism. Increased rate of ethanol. It is rapidly metabolized, so the tolerance. There is cross tolerance. Also, you should be familiar with this cross tolerance. Tolerance to like the similar other sedative drugs. Then there is psychological and physical dependence. Psychological and physical dependence. So if you stop this, drug all of a sudden, so very, untoward effect may appear even in the seizures are there. Delirium tremens. One well-known term about is the delirium tremens. Delirium tremens. There may be even death. You stop all of a sudden. So alternate drugs are given. Then neurotoxicity. This. The toxic metabolites, say acetaldehyde, it has got peripheral neuropathy. In the periphery, nerves are damaged. Neurotoxicity, ataxia is there, dementia is there. So there may be demyelination of the nerve, demyelination. And another very important neurotoxicity is the Wernicke-Korsakoff syndrome. Wernicke. It affects the eye muscles, the ocular muscle which controlling it. They are affected, and normal disorientation. Wernicke-Korsakoff syndrome is something very important. So the treatment of this neurotoxicity is thiamine. No, don't. Thiamine, say for 50 milligram intravenously given. So in the neurotoxicity, in the Wernicke-Korsakoff, the visual acuity that is impaired, optic nerve is degenerated. So neurotoxicity is also very important with the chronic heavy injection. Wernicke-Korsakoff syndrome. Some words about what is Wernicke-Korsakoff. A syndrome associated with chronic alcoholism and thiamine deficiency. You've been told of thiamine deficiency. Characterized by there is paralysis of extraocular muscle. Extraocular muscles, they are paralyzed. Ataxia is there, confusion is there. So the treatment is thiamine, 50 milligram IV. And there may be even permanent memory disorder with this Korsakoff psychosis, Korsakoff syndrome. Please, it may be asked in your why. Then CVS. On the CVS, you have been told about this liver is, this heart muscle is a cardiomyopathy. There may be heart failure, dysrhythmia, arrhythmias are available. Some of the people, 5% of the people, they have direct effect of the ethanol and the blood pressure goes. And maybe, due to vasodilation or other effects, it may come down. So, on the CVS, moderate alcohol consumption prevents. This is something, people claim that as the HDL cholesterol that increases all it is beneficial HDL cholesterol. So the chances of coronary heart disease, they are prevented. They are prevented, no doubt. The only benefit what I have seen. About the effect on the blood, mild anemia, microcytic hypochromic anemia may be there, folic acid and macrocytic megaloblastic anemia may be there, and this anemia is due to GI bleeding from the gastrointestinal, hemolytic syndrome associated with hyperlipidemia and severe liver disease, hemolytic. Another effect is on the endocrine system, steroidogenesis inhibitors, steroidogenesis. So the gynecomastia may occur, testicular atrophy may be there, some, and effects will also appear on the fluid level and the electrolyte. So when the liver is affected, there may be ascites, edema, effusions, altered body potassium. So potassium level is affected, muscle weakness will be there, vomiting and diarrhea. There may be secondary aldosterone, sodium is converted. Metabolic derangements, hypoglycemia, ketosis, hypoglycemia, note down, and this gluconeogenesis that is inhibited, and other things related to glycogen. So overall, the blood glucose level will come down. If there is you need to give glucose or other measure to bring the glucose level up. Metabolic derangement, hypoglycemia. Immune system you were discussed earlier. It is affected. It enhances the inflammation in the liver and pancreas. So the liver is affected. Pancreatitis, you have been told, we have gone through in one slide. Inhibits immune function in some tissues. Immune function. So it is benefactor tuberculosis, maybe. Viral disorders, they will affect. Heavy use predisposed to infectious pneumonia. Pneumonia will affect. A number of diseases, 30% comorbidities are related to this alcohol heavy consumption. Then cancer is also related to it. Alcohol is not a primary cause. As written over here, it's not the carcinogen, but they say other things present in the alcohol preparation. The primary metabolite is the acetaldehyde and the ROS produced by increased cytochrome P450 activity can damage DNA. So the effect will occur on the DNA. This ethanol increases the risk for cancer, all kind of cancer. They are also related to, say, the GIT, mouth, pharynx, respiratory system, esophagus, liver, breast. A number of cancers they are related to use of this. Another important, fetal alcohol syndrome, something very, very important. Mother is just taking it, so the fetus is affected. So it has teratogenic effect. If the alcohol is heavily used in the initial weeks of the pregnancy, so what will happen? So teratogenic. If the alcohol ingested in the, say, the third term of pregnancy, so the less weight will be there, baby weight will be less. Here given syndrome caused by teratogenic effects of the pregnancy, intrauterine growth retardation. Growth is retarded. Very typical picture, microcephaly, very beautifully presented over here. by your teacher, Dr. Pracha. Microcephaly is there. Muscle coordination is a problem. In underdevelopment, flattened face, underdevelopment, mid-face area, flattened face. There are minor joint anomalies. There may be heart defect, congenital, and mental retardation. Please go through this fetal alcohol syndrome. It is asking your Bible. Here, it's laws again. After cohort drug interaction, told that cytochrome P450 that is induced. So a number of other drugs there. Here is one very important interaction. If someone is consuming this paracetamol, acetaminophen side by side, and this toxicity is very important. Side by side. So the hepatotoxic effects will appear. Then acute alcohol inhibits metabolism. I have over here acute alcohol inhibits metabolism. Number of other drugs, phenothiazine, tricyclic, TCL, tricyclic antidepressants, sedative hypnotics. These are drug interactions that are pharmacodynamic drug interaction. As you know, it has got suppressant well. So if you give other suppressant drugs, so their effect will be additive. Additive, not non-additive. CNS depression with other CNS depressant, particularly sedative hypnotic. Then potentiate effects of vasodilators. You know there is vasodilation used as alcohol sponges. If there are also glucose level that goes down and you are giving this alcohol, so further hypoglycemia may be there. Or digestion. How to manage very important. In toxic effects. The vital signs in your general, you all know what are the vital signs. Note on vital signs. So you have to maintain prevention of asthma. So be careful if the person is in coma state, and you must give him a side. So it is not aspirated. Aspiration is a big problem. Correction of electrolyte imbalance. Intravenous dextrose is to be given to avoid this, to treat this hypoglycemia. Thiamine is something very important. Potassium, there will be loss. If vomiting is there, you also need to give potassium. The electrolytes are to be. You stop this withdrawal. All of a sudden, individual physically dependent on ethanol discontinuance can lead to a withdrawal syndrome. Very well-known, delirium tremors. This note this or delirium tremors is coming later on. Characterized by you stop there will be agitation, hyperexcitability, anxiety, tremors, insomnia, नींद उड़ जाएगी. And in severe cases, life-threatening seizures. Seizures are something very important. So the delirium tremors may be there, and that is, life-threatening. Peripheral effects include nausea, vomiting, diarrhea, and arrhythmias. Arrhythmias will also damage the stopper. So be careful while treating. You have to give alternate drugs side by side. Severe form of alcohol withdrawal. Its main symptoms are sweating, tremor, confusion, and hallucinations. Severe. If you all of a sudden. So after some hours or some days, severe form of COVID, so the symptoms will be sweating, tremor, confusion, hallucinations. Tremors, confusion. Here is one beautiful picture. You stop the drug. There is in essential called discontinue. You discontinue alcohol. So what will happen in the first picture above? Anxiety, insomnia, tremor, or palpitation, nausea, anorexia. Then second one is the seizure, something very dangerous. Then hallucinations. And then on the lower side you see tachycardia, hypertension, hyperexcitability, fever, tremor, diaphoresis, sweating, delirium, agitation is there, and a person may die if not proper. Management again. Electrolytes are to be managed, thiamine is to be given, benzodiazepines for these seizures, not on bother. Now, liver functions are to be monitored, normal liver function. What drug are to be given? In this case, long-acting drugs are given, diazepam, clotrimazole. If the liver function is compromised, then you will give lorazepam, oxazepam. Alcohol dependence, how to do you have it as a psychosocial therapy. Drugs that reduce the craving for alcohol. How craving, drugs abuse, and the drugs which are abused, craving is to be controlled. One drug over here, it is also study in the opioid antagonist, opioid receptor, naltrexone. The other one is NMDA glutamine receptor, a camprosate. Then aldehyde dehydrogenase inhibitor or told the disulfide drugs not approved. Certain other drugs which are not approved, you should also say the serotonin receptor antagonist, ondansetron, topiramate, GABA receptor antagonist like caution. Naltrexone plus disulfiram, both hepatotoxic. Patient must be opioid-free before initiating naltrexone therapy. A camprosate is contraindicated in patients with severe renal impairment. So these are the cautions. Disulfiram is something very important as there are only 45 minutes to complete it. We will send you the picture and you have to go through anyhow. Disulfiram reaction is very important. You must go through yourself to the methanol and other alcohol, methyl alcohol. You must see as because of the time limits, the course is to be closed after certain weeks, a month, more than a month, like that. So certain things you will study it yourself. Methyl alcohol, something very toxic, so it damages your eyes. Methanol poisoning, you see, you have to go it yourself. So most of the tests are related to methanol. Ethanol, is something very expensive. So kindly please go through. No more time can be given about this lecture. How to treat methanol. Specific antidotes are very, very important. We will close it now. For methanol, ethanol is given. For ethanol, methanol is given like that. Also, for methanol, urine is alkalinized. Given here is again, metabolism of adverse effects of fumepizole are also there. It's this antidote. You must go through a burning and infusion. Then ethylene glycol is a preservative. So in number of medicines and other stuff. So poisoning, what will have the effects around CNS, anion gap, metabolic acidosis, deposition of oxalate and renal tubules, where you pair ethylene glycol. Again, the treatment for it is fumepizole and also ethanol hemodialysis. There is one table I'll send you where what is the toxic element and what is the antidote. Thank you very much. Hope you to study the rest of the these which couldn't be covered over here due to time.